Hello everyone, welcome to sqadia.com, and now we will continue with section 1 of our lecture, which was axial skeleton. In this section we will go over the overview of the skeletal system, and then we will cover in this section what is skeletal system made up of, what are some functions of the skeletal system, and what are the divisions of the skeleton. So let's start with our lecture topic today, overview of the skeletal system. So structures of the skeletal system. As you all know, bone is the main part of the skeleton of our body. But besides bones, we have ligaments, tendons, and the cartilage. There are about 206 bones in the body. And then if we go over these bones, you have the diagram of this skeleton here, complete skeleton. So if we go on the top, we have the cranium or the skull, and this skull is divided into two parts, cranium, and then we have the facial bones. These are the facial bones. Then we have clavicle. Clavicle is also known as the collarbone. Collarbone. If you touch your hair on top, you can feel your clavicle. This is the clavicle. Very superficial bone, very easy to break. This is the clavicle, and it is also known as the collarbone. Then this is the sternum, and the sternum is also known as the breastbone. These are the ribs. These are all the parts of the ribs, sternum, and your skull are the parts of your axial skeleton, which we will talk in detail later on. But right now we are just covering the basic skeleton. Then we have the bones of the upper arm. Your upper arm has one long bone. This is the humerus bone. And then the lower arm has the radius and the ulna. Radius and the ulna. Your thumb side is the radius. And then your little finger is the ulnar bone. So thumb is the radius and the little finger side is the ulna. And then we have the bones of the wrist. Wrist bones are known as the carpal bones. These are the carpal bones. Then the bones of the hand. Hand bones are known as the metacarpals. And the fingers are the phalanges. So wrist bones are the carpal bones. Hand bones are the metacarpals. And then we have the fingers, which are the phalanges. Then bones of the lower leg. Bones of the leg, upper leg, or this bone is the femur. The strongest and the longest bone in the body is your femur. This here is the patella. Patella is the kneecap, patella. Then we have lower leg bone, which is the fibula, very thin and long bone. Fracture of the fibulas are very common because it's thin, cannot handle too much pressure, and it fracture very easily. So fibula. Then the thicker bone in the lower leg is the tibia. So in the ankle we have tarsals. In the foot we have metatarsals, and the fingers of the foot are the phalanges like the hand. Then this part is your hip bone or the pelvis. Hip bone is divided into three sections: your pubis, ischium, and the pubis. This where it is joined together is your pubic symphysis. Ischium is little on the back. So ilium, ischium, and the pubis. This where the two hip bones join is in the center is your pubic symphysis. So this is roughly about the skeleton. All these bones constitute your skeleton. So as you can see, so many 206 bones in the skeleton. So major component of the skeletal system is the skeleton, and skeleton is made up of 206 bones. Next is your ligaments. If you see in this diagram, you have ligament. Ligaments are fibrous band that connects your bone to bone. We need something to keep the bones together. Whenever there is a joint, joints are formed, you need attachment to connect one bone to another. Joints are the union between two and more bones. This is the picture of you see here is the femur. So femur is the leg bone. So here is your knee joint. They are showing you the knee joint. Ligaments connect bone to bone. Tendons are the structure that connect muscle to the bone. So muscle to the bone. Here in this picture you see Achilles tendon. This is the largest tendon in your body. If you feel the back of your lower leg, you can feel this tendon, this hard structure on the back, and it's connecting your gastrocnemius muscle on the back to the calcaneus. Calcaneus is the heel bone. So this connects the gastrocnemius muscle to the heel bone tendon. So ligaments connect bone to bone. We need ligaments in the joints, which is the union of two and more bones. And this is the tendon. Tendon connects the muscle to the bone. This is the tendon. Then the last structure I mentioned here is the cartilage. Cartilage is very soft structure. We have cartilages present. They are flexible, little softer than the bone. So what happens is they allow mobility. Wherever there is movement, we need it. Cartilages are present at the end of the joint bones to allow the friction or mobility in the joints. And then they are also present at the end of the ribs. They are present in the intervertebral joints. Cartilages are present in the ear and in the nose. So this slide, we cover the structure of the skeletal system. Bones, ligaments, tendon, and the cartilage. In the next slide of your overview of the skeletal system, these are some functions of your skeletal system. Our skeletal system perform very, very important function, which is one of them is support and shape to the body. It provides support to the attachment of so many muscles, ligaments, tendons. Without the bones and their attachment, these structures are loose and just hanging down. So provide the support to the body and shape to the body. With age, as the bone loss its matrix or mass, the shape is person can become short stature, and the bones become very weak. So all these kind of problems can occur due to the loss of bone. So support is very important function of the bone. Then protection. Another important function, protection. It protects vital organs of the body. Your skull protects the brain. Your vertebral column protects the spinal canal or spinal vertebrae. And then the other protection is ribs. Ribs protect your heart, lungs. All these are very vital organs of the body. Without the protection by the skeletal system or skeleton, they can be damaged very easily. They can be injured very easily and cause serious consequences. Then the other important function of the skeletal system is the movement. We cannot move without the skeleton. So movement is another important function, and here we mention some important movements of the skeletal system. So here we have the flexion. Flexion is the bending. If I bend here, this is the bending. Here in the diagram you can see the bending of the leg. So this is flexion. Flexion is the bending. Next, extension, straightening. Flexion, bending. Extension is the straightening. And then we have abduction and adduction. Adduction is towards the body and abduction is away from the body. So flexion is the bending, extension is the straightening, abduction is away from the midline or body, and adduction is towards the midline. So these are 4 important movements of the body. Then other is we have circular motion, rotation. Here they are showing the circular motion. Then we have pronation and supination. Supination, if we talk about the palm of the hand, this is the supination. Palm facing up is the supination. Palm facing up. Pronation is the palm facing down. So supination and pronation. Then we have inversion and eversion. Very commonly this movement is done on the foot. Inversion and eversion. This positioning is with the movement of the sole of the foot. When we do inversion, our sole is turning inward, and eversion, the sole of the foot is turning outward. So these are very common movements of the skeletal system. Anywhere you can perform these movements. Here we show you the picture of the leg, and here pronation and supination of the hand. Similarly, if this is considered when we talk about the fingers of the hand, this is the midline. Let's see, this middle finger is our midline. So we have flexion is bending, extension is straightening, abduction is away from midline. We consider this as a midline. So abduction is away from midline. Adduction is towards the midline. So abduction, adduction. Flexion of this finger, extension. Supination, pronation. So all these movements are very important, and any angle, any joint, you can perform these movements. Then other important function of the skeletal system is the storage of minerals, and the most important minerals are the calcium and phosphorus. Calcium is very, very important. Bones are the rich source of calcium. And when our body needs calcium, and when the calcium level is low in the blood, what happens? This low blood calcium level causes the release of parathormone, which is the hormone produced by the parathyroid gland. And this parathormone hormone in turn causes reabsorption or resorption of bone, and calcium level is increased in the blood. So this is very, very important function. Calcium is very important for our body. Then formation of blood cells is another important function of the skeletal system. In the long bones and in the bones we have bone marrow, and this bone marrow forms the blood cells, which are red blood cells, white blood cells, and platelets. So all these cells are formed in the bone marrow of the bones. So this was the function of the skeletal system, in which we talked about the function like protection, movement, storage, and formation of the blood cell, and it provides shape to the body. The next slide is, now we talk about 2 divisions of the skeleton. One is the axial skeleton. As you see, axial skeleton makes the straight vertical axis in the body. That's why it's called the axial skeleton, which covers your cranium, vertebral column, and the thoracic cage. And appendicular skeleton, which covers the appendages of the body, and these girdles of the body. These are the girdles: shoulder girdle and the pectoral girdle or pelvic girdle. Here, appendicular skeleton, this is the, again, femur. It combines with the sternum, and on the back we have the scapula. So this makes the shoulder joint here. And then we have radius, ulna, and the carpal, metacarpal phalanges, and this hip bone or pelvis. Then we have femur, tibia, fibula, metacarpals, tarsals, metatarsals, and the phalanges. So this is your appendicular skeleton, and this is the axial skeleton. Since the topic of our lecture is axial skeleton, so from now moving to the other sections, we will mainly talk about the axial skeleton. So hopefully you got the idea of the basic functions of the skeletal system and different structures that make up our skeletal system. So with this division of the axial skeleton, we concluded our first section of this lecture. And in this lecture topic, we covered the overview of the skeletal system, in which we talked about what structures make up the skeletal system, what are some functions of the skeletal system, and about the divisions of the skeletal system, which is axial skeleton and the appendicular skeleton. So from now on, in the next sections of our lecture, we will talk about the parts of the axial skeleton in detail. Thank you for watching sqadia.com.